Madam Chair, first I would like to express my sincere thanks and gratitude for inviting us to be part of this highly reputable meeting, the United Nations Science Summit 79. My name is Professor Fahal. I'm a professor of surgery, University of Khartoum, the Mycetoma Research Center. I'm going to talk about the Mycetoma Center, the experience, its history, and activities. I would like to declare there is no conflict of interest in this presentation, and all photos, images were taken after a written informed consent. I'm going to talk about mycetoma as a neglected tropical disease with many socio-economic, medical, and health impact on patients, communities, and health sector at the affected region. I'm going to talk about the Mycetoma Center activities, the war impact on its activities, the way forward, and I'm going to share with you some take-home messages at the end of the presentation. The main objective is to share with you the Mycetoma story, the activities done at the Mycetoma Center over the last 30 years. The Mycetoma Center was established in 1991 under the umbrella of the University of Khartoum, based at Soba University Hospital. It is the only WHO collaborating center on mycetoma and skin entities. Ladies and gentlemen, mycetoma it is one of the chronic neglected tropical diseases characterized by massive deformities, destruction, leading to loss of activities, loss of life of the affected patients. You can see how miserable the condition is. Massive deformities, destruction, disfigurement, and a mutilating problem. Over the last 30 years, the Mycetoma Center managed to see and to treat and to manage more than 12,000 patients. We conducted the first ever double-blind clinical trial for a new drug for mycetoma patients, utilizing a new diagnostic tools to diagnose the condition. We have two satellite centers at the mycetoma endemic villages, White Nile State and Sinnar State. And again, we established the first ever vocational training center as well as entrepreneurship center to help treated patients back to normal life. And again, we had a lot of training activities for health cadre and personnel in the affected regions. In the area of research and development, we have more than 50 postgraduate students. We have more than 300 articles published in different journals globally. We have different research projects going on, and we established the first ever Center for Neglected Tropical Disease clinical trial in the region, as well as utilization of artificial intelligence in diagnosis and management of mycetoma patients, as well as a program for training of undergraduate and postgraduate students. In the area of the community engagement initiative, we had different satellites in the region where mycetoma is endemic. We have a media center. We managed to produce more than 180 video films, clips on mycetoma advocacy and awareness. We have a lot of campaigns for prosthesis, health education. We are engaged with many fine artists, comedians, celebrities to advocate for mycetoma activities. We have a Mycetoma Friend Association to support the mycetoma patients. We have several ambassadors working together to improve the quality of the life of mycetoma patients. Then suddenly the war started out of the blue, and that had badly affected a lot of premises in the country, and the Mycetoma Center is one of them. This is the Mycetoma Center just few days before the war, and this is the postgraduate annex, and where we used to have a lot of activities going on. And again, that war had led to displace of patients, staff, medical doctors, students in different parts of the country and overseas. Again, sadly, this war had interrupted the training of our trainee, professional, educational, as well as in other activities. And again, sadly, the training and the education activities stopped, and this is one of the activities in the center before the war. Now we are working online with our young colleagues, working to keep them in the loop, to train them and to guide them during this difficult time. And this is the Mycetoma Young Researchers Association doing a lot of weekly activities and events to keep everybody motivated for the new era after the war. Again, the equipment and the consumable has been badly lost during this war. And that is important for the training of our young colleagues and conducting the research. Most of our engagement activities and initiatives stopped at the level of the community with this war, and again that had badly affected the affected communities in this. We have more than 25 international collaborative bodies, and we are very much acknowledging their activities and support of us during this difficult time. We are missing our patients. They were giving us the drive to continue and to work. Hence, we moved from Khartoum to Jazeera, Sinar State, and now we're having our activities at Kassala State. We're having a clinic and we're working with the patient there. But that is not enough. In conclusion, ladies and gentlemen, I would like to say that mycetoma is a scar on the human conscience, and our job it is to heal it, and we are working on that even at this difficult time. And thank you very much for your kind attention.